welcome to the deep dive. Today, we're looking into something you might just dismiss as, achy legs, but it's actually a big deal for your overall circulatory health. We're talking about peripheral artery disease, or PG,
Right.
and we're specifically going to connect the dots between PA and high blood pressure. Our guide for this is Dale Ruddock's book, Lowering Blood Pressure Naturally.
Mm,
So the mission today is to really understand that link, what it means for you, practically speaking, without getting lost in medical jargon.
exactly. And what's really interesting in Ruddock's approach is how he views our blood vessels as this whole interconnected network. PAD, like he explains it, isn't just some isolated leg issue. It's the narrowing or even blockage of arteries, usually the ones going to your arms and legs. And the main reason, it's typically atherosclerosis. That's the slow buildup of plaque inside the artery walls.
Okay, atherosclerosis. So let's dig into that connection with high blood pressure a bit more. We hear a lot about high blood pressure in the heart, the brain. How does it specifically play a role in, this plaque buildup in the limb arteries based on what Ruddock says?
Well, Ruddock really emphasizes that high blood pressure, when it's constant, puts chronic stress on the inner lining of your arteries. It's called the endothelium.
The endothelium, okay.
Right. Think of it like, well, the high force of blood flow day in, day out can cause these tiny little injuries or spots of inflammation. And these damaged spots, they become sort of sticky, more likely to grab onto cholesterol, fats, other stuff floating around in your blood.
Ah, so they're like little footholds for plaque.
Precisely. That's how the plaque starts forming.
Mm.
And over time, it builds up, hardens, narrows the artery, and restricts blood flow. And that is essentially PAD.
That makes a lot of sense. So it's the sustained pressure, the long-term effect, that really kind of paves the way for this, like constant wear and tear.
Exactly. It's the chronicity. And this reduced blood flow, Ruddock points this out clearly, it causes problems. The most common thing people notice first is often leg pain when they're active, like walking. That specific pain is called claudication.
Claudication.
Right. It's basically your muscles screaming for more oxygen. But it doesn't always stop there. You might also feel numbness, or your feet or toes might just feel persistently cold. And here's where it gets, quite serious, and Ruddock really stresses this. If PAD gets severe and isn't treated, that lack of blood flow can mean wounds don't heal. You can get infections that are really tough to clear up, and in the worst scenarios, tissue can actually die, which might even require amputation.
Wow, that's a very serious outcome. And Ruddock's book makes it clear this isn't just contained to the legs, is it? It's a wider warning sign.
Absolutely. He's very clear on this. If you've got significant plaque buildup in your leg arteries, the chances are high that something similar is happening elsewhere. In the arteries supplying your heart, your brain.
So PAD is kind of like the canary in the coal mine for potentially more widespread cardiovascular disease.
That's a great way to put it.